side. You're watching WBRC Fox 6 News Good Day Alabama Extra.
And welcome back into Good Day Alabama Extra.
All right, we are talking about today rock and roll legend Mick Jagger recovering this morning from major surgery. Billboard reporting that the Rolling Stones frontman underwent heart valve replacement surgery yesterday. He's now, we understand, resting comfortably and recovering.
So the health concern prompted the band to postpone their North American tour over the last weekend, and Mick Jagger apologized to fans on Twitter, saying he would work very hard to be back on stage, but doctors say he may be released from the hospital in a matter of days. So what does that heart valve replacement look like if you needed that procedure? And how do we know if we even...
Dr. Stephen Bakir is here. He's an interventional cardiologist at Brookwood Baptist Medical Center. Good morning. Good to see you. Good morning. Cardiovascular Associates.
Thanks for having me.
So you brought in something to show us today, because it actually, that procedure itself has changed, right?
The traditional way to replace an aortic valve is a surgical approach where the patient goes to sleep for general anesthesia, the chest is opened, and the surgeon cuts out the old valve and inserts a new aortic valve, either a mechanical valve, and you see the acronym here, transcatheter aortic valve replacement. And so it's either a mechanical valve or a pig or a cow valve.
Which is always amazing to me anyway, that's used.
Absolutely, absolutely. So the new advance in this has been developed initially in 2002 and approved in the States since 2012. And if you believe Billboard magazine, then he had his surgery at one of the pioneering centers at Columbia. But we do these procedures at Brookwood and several other hospitals around town. It's where a pig or a cow valve is sewn into a stent.
Oh, wow.
That is then collapsed onto a balloon that's roughly this size, goes in through the leg, and I don't know if they can see this, through an IV roughly this size.
Wow.
Goodness gracious.
The valve is threaded through the blood vessels, goes right in, the heart is beating, the patient is at times awake.
What?
Awake. that was not planned.
No, it was not.
Awake with the heart beating under just very light sedation.
Oh my gosh.
The heart is paced very briefly. The balloon is blown up. The valve expands inside the patient's native valve. You deflate the balloon, you take the balloon out, and the heart, turn the pacemaker off.
Wow.
The heart starts beating. And in the right circumstances, you do them on one day and the patient walks out of the hospital a couple of days later with Band-Aids on their legs.
Now, I will ask you about the success rate of this procedure in just a moment, but you take a guy like Mick Jagger, yeah, he's 75, but he looks rather thin. He's a guy you'd think would be in relatively good shape,
right? But
that's really not the major indicator, is it?
So all of us will get aortic stenosis if we live long enough. And it depends on
and aortic stenosis means?
Aortic stenosis is when the aortic valve, the main outflow valve for the heart, is not opening. It becomes calcified, and instead of billowing open like a sail on a sailboat, it opens more like a rusty door hinge.
And that's where we get the so-called widowmaker, right? If that has is that what
so
the same
the widowmaker is usually a term that's associated with a blockage in the heart artery, one of the vessels on the outside of the heart. A little bit different plumbing problem.
So this procedure that you described, though, it is so there's no other blockages then going on for that to be able to work. Is that right, or can there be blockages as well?
There can be blockages as well, and there's a reference in the Billboard article that he also had a stent to unblock a clogged artery. I'm not taking care of Mick Jagger, so I don't know. I don't know what happened to Mick Jagger, but it is certainly very common that we're able to address blockages with a stent to help open a blocked artery, and in a same procedure or in a different procedure at a different time, put in the heart valve. And so Mick Jagger is a pretty healthy person. These were just shown in trials from the ACC a couple of weeks ago to be superior to, or at least as good as, a traditional aortic valve surgery for the first year.
Wow.
It's
so
just
great outcomes.
It's just amazing. I know we need to wrap up, but is there how much of a difference in like using the pig valve and using the other valve? I mean, what's your goal?
So there's lots of differences, and the mechanical valves require long-term blood thinners, and they have a use, they have a niche, but we're using them less because of the of this technology.
That's fascinating. Wow.
Dr. Bakir, I'm just amazed that you guys do what you do, but we sure do appreciate you. And Dr. Bakir from Brookwood and Cardiovascular Associates. And I'm going to be visiting with them on Monday. I've shared that with people. I'm having a stress test, so
You'll do
I don't
just
want
fine.
that.
We're praying
You'll do just
everything-
fine.